and then
Okay, I am live right now.
Try to go on right now.
And I am going to go ahead and invite you as a guest. Okay. And I've sent you the invite. And so in the next couple of, in the next 20 or 30 seconds, you should see the invite. This is Dr. Khan. I'm going to go ahead and invite my guest, one of my patients.
She doesn't see it yet.
Okay, so not yet. It usually takes like half a minute or so to come on. And so we sent the invite, okay.
I'm in your live chat now.
Okay, got it. And there you go. And I'm going to go ahead and invite to join the broadcast. So that's it. Excellent. It's adding on right now. Thank you, Caitlin. So you should be coming on any second. This is Dr. Khan, Executive Plastic Surgery. And I'm going to go ahead and bring my guest on to... Okay, she's connecting. Send invite.
Just let her connect for a second.
Okay. So I'm going to go ahead and please bear with us for a minute or so. It says adding. Yep. So bringing them on. So we're going to wait. No answer from the live video guest. So she's being added on. Again, this is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. I'm basically inviting one of my previous patients to come on as a Facebook Live guest. And I am going to bring her on. Send invite. And I think it says overall adding over here. So this is good. We should have her come on. No answer. All right, there we go.
Hi.
So, yeah. No, I'm very happy. Thank you very much to everyone and to you certainly to coming on. I'm going to go ahead and adjust this so that I can see you clearly. All right. So a warm welcome to everyone. This is like a surprise guest, if you will. It's a pleasure to have you on and to share your journey. I say this to everyone. There is no other better person to talk to than your own previous patients, and so that we can learn from our experience. I'm going to go ahead and basically turn this such that I will be able to see you well. And can you hear me well?
I can.
Okay, very good. You actually have like a bright light coming from the back. If you can just reposition a little bit. Yeah, okay, good. If you can turn just the angles because there's a glare and we're not able to, now this is much better. Yeah, okay. All right, okay. Now this is wonderful. Welcome to have you on. So this was supposed to be a question answer session. And Friday afternoon, we talked, and I said you wanted to share your journey, and there's no other better person, like I was saying earlier, to talk about breast implant illness than one of my former patients. So basically, pleasure to have you on. I will go ahead and get started, and this is all essentially your platform. This is, remember, this whole Facebook page was created by one of my patients from Arizona, and you are in Arizona yourself.
I am.
And so the tribute, the honor, and the privilege, and this has been for the many ladies, and we truly are blessed to her for basically sharing her wisdom and knowledge and expertise in helping raise the awareness. So what I'm going to do is I'm going to go ahead and get started. As I understand, we are on also TikTok Live and Instagram Live, and hopefully we will raise this awareness so that we hear directly from you. So having said this, I will jump in as I see, and I'll help clarify. If any of the listeners have any questions, I have Caitlin, my nurse. She will help read some of the questions so we can answer, and they will be directed straight to you and myself so that you can help answer, and I can basically ask them because they will be read out by Caitlin. Having said this, please tell me about yourself. Like, when did you get your augmentation and how old are you?
Okay. So I'm 45 years old, and I decided to get breast implants in 2021. I decided this because I, like many women, wanted to do something for myself after I was done having kids. I was done with breastfeeding, and I didn't necessarily want to go bigger, but I wanted my breasts to be more lifted and raised to where they used to be. And so it was recommended to me to do breast implants. And so I did my research at the time and found a couple girls that recommended a surgeon. I saw his work on them and they seemed to have no issues. So then I made my consultation, and not knowing very much about it at the time, and obviously had I known then what I know now, this would be a very different conversation. However, at the time I was told it was safe, and I wasn't aware of all the cancers linked then at the time to breast implants, and so I decided to move forward. My issue is, as soon as I got the implants placed in me, within the first post-op appointment, I was diagnosed with capsular contracture, Baker's level 4, both sides of my breast. So they never dropped
Wow.
in the pocket that the surgeon created. So for me, I never actually got to experience breast implants looking good. They always were disfigured on me, and then gradually became more and more hardened, tightened, and painful.
Got it. And
Um,
so if I may clarify, so in the world of plastic surgery, there, according to Dr. Baker's classification, there's 4 ways to describe the capsules that form around the implants. Stage 1, or grade 1, excuse me, if you will, is where you have soft, normal, healthy appearing implants with respect to the chest and breast tissue. Grade 4, which is what you had, the implant is encased by a very hard capsule. It deforms the chest, makes it visibly deformed, and also the patient has pain. And this is where it's the highest of its kind, and you can actually see a distortion of the chest wall as a direct result of the implant itself. And this is what you had, not only on one side but on both. And this can occur right after augmentation, or this can occur 1 year, 5 years, 10 years later. So there are patients that I've seen, they were fine for 10 years, and all of a sudden this contracture occurred. And for vast majority of the patients, we do not know why it occurs. Sometimes there is a theory behind biofilm, that's bacteria that forms around, that can cause the body to form a capsular contracture. Sometimes it is the body's way of dealing with a foreign body. So in those patients where the implants are relatively larger, there is a higher chance for getting capsular contracture. And again, we do not know vast majority, but it's been shown. And again, depending on the studies you read, if you have an implant above the muscle, higher chance for getting capsular contracture. But again, vast majority of the reasons, we do not know why. On one side, you have a very normal aesthetic result, and on the other side, you have a grade 3 capsular contracture, which is the same thing as 4 minus the pain. And in your case, you had both.
correct. And so it was then, so right away, the implants didn't work. And right away, I was confronted with, okay, well, the only way to correct this is to remove the implants, is surgery. The
Now,
only way to correct
did your surgeon not talk to you about what can be done in order to help with that capsular contracture?
No, he said, as I remember correctly, he just recommended, he said that the only way to fix my level of capsular contracture was through surgery.
Right. Now, sometimes, so what has been reported, and this is very well studied in literature, they can do a closed capsulotomy, kind of break that capsule. Sometimes they can go in, and there are asthma medication that can be prescribed that helps break it down. It's been shown that's kind of one of the better side effects of it, if you will. There are times where surgeons have gone in surgically and scored the capsule, meaning cutting it open. So now basically it's not as tight because it's not healthy and normal. I am always surprised to see how patients live with grade 3 and grade 4 contracture over the years and decades. And this is not healthy and this is not normal for someone to be living with calcified capsules, hard, thick capsules, capsules stuck to the chest. Because now when you start moving your arm around, it's literally super glued to the chest, and that certainly compromises the movement. It is not healthy to be living with grade 3, grade 4 capsular contracture. And again, this is where the many ladies I've taken care of in the 50s, 60s, they've been living for decades with this. Now, please go ahead. So you basically were told, I guess in your case, given the intensity and grade, that surgery was the option. Yes,
Right.
please.
And at that time, he recommended removing and replacing with new implants. And this time, previously I had chosen saline, and I had chosen saline because of the silent rupture issue, and I didn't want to have to worry about MRIs every year to stay on track of that. So that's why I chose saline, so I would know if there was a leak right away. However, now he was recommending to me that he recommended full silicone to be put in me, and gummy bear one specifically. And this was because of the fact that now my skin was stretched out due to putting in the implant. So it's a little thinner and now deflated, and it would be deflated and it would be baggy skin. And so he said the way to correct that and the way to remedy that would be, his suggestion was to replace with new. So at this time,
Can I jump? Can I jump in? So I just want to mention a couple of things because as you're teaching, I can help understand this better for my listeners and our viewers and listeners. The saline implants, when they do rupture, they rupture completely like a water balloon. Silicone implants, you could poke it with a needle, it would still retain its shape. It would not necessarily deflate like that saline implant. Now, according to the mentor itself, for example, they will tell you get an MRI at year 3, and then every 2 years they're onward looking for a silent rupture. Silent rupture means that you're ruptured and your exam looks unremarkable. And so they recommend at year 3, and then every 2 years they're onward. Now, the other thing I want to mention, if someone gets capsular contracture once, if you replace them, chances of getting a capsular contracture only occurs even more so because the body is showing you that if I form a capsular contracture once, it's only going to form again. So sometimes what surgeons like to do is if they were above the muscle, then they put the implant below the muscle, so less chances of a capsular contracture. Sometimes they like to use alloderm, which is cadaveric skin, to put around the implant. So the chances of a contracture now are relatively less. So so if one gets capsular contracture, chances are very high that they're only going to form capsular contracture again. So replacing them with the silicone is not going to, from my experience, going to help circumvent that problem. So please go ahead.
absolutely. And he did mention that risk to me, saying now because I had it before, I am more likely or have a higher risk of it happening again. And then at that point, it would be game over. It doesn't work for you. That's it. At that point, I wasn't ready to really, I mean, the conversation that I had with my surgeon about, because I had started to exhibit some of the breast implant illness symptoms at that time, but I didn't connect everything yet, because when I first addressed it with my surgeon, he basically said breast implant illness isn't a real thing. It's not proven. It's not medically recognized. And so that was the gist of the whole conversation I had about that with him. And then he said, basically, go figure out what's wrong, come back and see me, and I'll fix you up. You paid your fee, I'll replace it, and we'll go from there and see how that goes. So that was the plan. But as soon as I went home, I started exhibiting more and more and very rapidly many symptoms. Systemically, my body was presenting all sorts of problems, even so much so that I ended up having to postpone my fixed date of removing the implants to do other surgeries first, to take care of my health first. And so during this time, as everything was going awry and wrong, I started doing a lot of research. That's when I found you. That's when I found Dr. Henry Dykman. That's when I started researching all sorts of TED Talks, data, documents, any information I could get on capsules, on capsular contracture, on breast implants, on the side effects, on everything. I wanted to know everything and what my options would be. And by that point, I just wanted them out of me. I wanted it to be just back to myself, to give myself whatever chance I could to get better, because my hair was falling out so fast. There were bald spots. That's never happened to me in my life. It was a nightmare for me to go through, losing my hair. And I was going to do anything that I could to save my health, my hair, and my breast. And so I decided I wanted them absolutely out, capsules and everything. So when I went and
let me jump in. If I may just mention, Caitlin, can you go and get that mentor advertisement from the clinic? How sure were you it was these implants?
Well, prior to this, I had normal annual checkups every year, no pre-existing conditions. I had normal annual mammograms, and right up until that very month that before I did implants, it came back normal, my mammogram. After this, my hair started falling out. I started having all these symptoms, rashes all the time, and very, very hard to manage, hard to deal with. I lost weight. I had increased anxiety, panic attacks, night sweats. I lost weight. I had kidney issues. I had fatigue. I had 3 masses grew in me the 1 year, and I only had breast implants in my body 1 year. And I had a new mass grow in my breast and 2 in my ovaries. This concerned me because my mother is an ovarian cancer survivor, and I believe because I am high dense breast tissue that I'm a slightly higher risk for breast cancer. And so due to all those concerns and all those things, and because I found out about BIL-ALCL and also SCC, and also the 12 new plus lymphomas associated and directly linked to breast implants, I was like, absolutely not. I'm not taking any more risks. I just want it out. The problem is that what I found is in the community, I guess a very common thing is to take out the implants, but leave some behind. And to me, that seemed wrong, and I didn't want that. I wanted everything out. And so when I had that discussion with my original surgeon, he assured me, yep, we'll try and get everything out, and I'll burn.
When you say try to get everything out, what does that imply to you, to the listeners?
The implant and anything that looked suspicious, infected, or swollen, or anything
capsules
around the capsules, yeah, within my breast, right? And so, oh, now I just lost my train of thought. I'm sorry. So, anyways, I absolutely was.
So this is you had the discussion with your surgeon, you had all those symptoms.
Yeah.
And that you basically needed to get all of that capsular tissue, inflamed tissue removed for around the periphery. And these were the set of implants that you had just gotten not too long ago.
Just paid.
So when did you go through your explant?
As soon as I could. So like I said, I had my surgery scheduled at 6 months, they were put in, but I had to postpone that because I had to end up having 2 kidney surgeries. And a stent and all sorts of other things. So I had to wait to heal from that, wait to heal from the initial implantation surgery, wait from those surgeries. And then once I was able to go in, it ended up being right exactly the same month within the year mark. So in May 2022, I went in to have them taken out. And at that time, I had decided I do not want to replace with anything. I wasn't sure what I was going to look like. I had all the same questions that many women do. I wasn't 100% sure that this was going to be the fix everything. But I had done enough research to that point, and I had watched you perform this surgery enough times, and I had read other people's experiences that I met through this very, very useful, wonderful support group. And I decided, whatever happens, my health is most important. I want them out. And so I went ahead and got them out. But I wasn't feeling better. And even though he assured me that he got 99-98% of it and burnt and scored off the rest, so I was good, I just didn't feel.
How much after your surgery, after you got your explant surgery? So I remember in May of 21, you got your augmentation. In May of 22, you got your explant. And this was supposedly a capsule removal. All of it was done, right?
That's what.
Yeah. Now, question for you is this: how much better did you feel after the implant was removed and that supposed capsule removal?
Well, first of all, it took me 4 months just to get my post-op notes back. And I was really waiting for that to see in there exactly and specifically how much he was able to remove. But as I was waiting for it, and some stuff resolved right away,
Like what?
immediately. But like,
If you remember it.
well, I remember immediately my scalp felt different. It was like it had more air to breathe in it. I don't know. It felt different from the day before when I had implants and they took them out, and it felt different. Um, and then other stuff started subsiding, like the rashes went away. My migraines that were almost every day, that went away. So a couple of those things started right away, not exhibiting, but there was other things that were still there.
Like what?
So I still had some pain. I still had some dryness of eyes, the fatigue, night sweats. I still had the anxiety. I still had interrupted sleep. I still had the weight loss. I still had, I was recovering from all these other surgeries. So my body just wasn't where I normally, it wasn't as active and healthy.
Right. Now, if I may, I have your chart right here, and I have the whole questionnaire symptom list. And just like I'm looking at it, because remember, as you come and all my patients that come, this is where my way to gauge. You had the chronic fatigue, brain fog, muscle ache, pain, weakness. You had the joint pain. You had hair loss. You had literally highlighted this area. Dry skin, weight loss, easy bruising. Most of my patients, believe it or not, it's weight gain. You had temperature intolerance, night sweat, skin rashes, insomnia. You had dehydration, shortness of breath, chest pain, headaches, dizziness, migraines, anxiety, panic attacks, and you had vertigo and pain around the breast. So you had this highlighted, and this is where, for someone young like you, this was the way for me to gauge that these were the symptoms that you were still exhibiting. Now, let me ask you this: how much better did you feel before, like when you had the implants, and then afterwards, how much better did you feel after having explanted with the other surgeon?
Um, I didn't feel all that much better. And
like you noticed that your scalp was different in a better and in a subjective way. you had some improvement, but obviously not a whole lot, not quite.
I had a long list of problems and only a few were being resolved.
Got it. Okay.
And mentally, and just to show you, this was my hair right before breast implants. And this is what happened to my hair after breast implants.
Mm-hmm.
So I had bald spots and it was coming out fast. And I was concerned. I was concerned with my health. I was concerned over so many things. And I just wanted the peace of mind to know no foreign objects were left in me. Nothing would come back to maybe hurt me later on. And so I had a plan in place already before I went through that explant to, if it wasn't going to work, if I wasn't going to get better, or if I suspected that maybe he didn't do the job that I wanted him to do, my backup plan was going to fly to Michigan and go to an expert doctor that I had found who was helping women all around the world highlight this very important issue. And because I watched you do the surgeries before, and because I learned so much from you about my issues, capsular contracture, and the many other issues in this topic, I felt a confidence in you from a distance that I hadn't felt from my first surgeon. And I didn't want to go through and find another surgeon and run into the same possible issue with my first surgeon. And that is why I chose you, because I knew you get the job done. I saw you get the job done, and that's what I wanted, was the job done. So I went to Michigan, I got my explant, I paid extra money. And now that I have done that, it was the best decision I ever made. Almost all of my symptoms are gone. My breasts look way better than I thought they would. Dr. Khan, you transfer. Everything was sent to pathology to rule out all the cancers. So the peace of mind that I was given was huge. And because of that, my anxiety has decreased a ton. And the panic attacks, I haven't had any since our surgery almost a year ago, 11 months ago. I do still have anxiety, and it increases every time I have to go to a doctor for an issue because of all of this. I ended up going to more than 60 doctor's appointments in 1 year, which is crazy for me because I had never done that, anything like that in my life, and many different specialists in many different areas. And it was very overwhelming. And that isn't the only thing that I was navigating. I'm a stay-at-home mom. I have 3 kids. I'm busy. I'm also a property manager. I also have other things that I've got going on. So I missed out on so many things and lost so many things. And I just wasn't willing to lose one more thing. And I wasn't willing to risk anything else. And I'm glad I did. I'm glad that I saw you. I'm glad that I took it out. And you know, not everything's perfect, and everything, you know, the wave thing that ladies talk about sometimes, where things come back in waves, that happens. That's happened to me. I'm currently dealing with some new breast pain issue in the right breast that has the mass. They found the mass in, so there's some concerns there. But other than that, I'm not afraid anymore because I have the information. I know where to go to get the help that I need to get. I know what to do. I know what my options are. And now it's just figuring out what and tailoring.
Sure. No, thank you. If I may jump in, there's a lot you have said, and if I will help digest. This is your pathology report. Your pathology, and I'm going to read it. So, final diagnosis read by Dr. Hema Govil. She's one of the board certified pathologists here with Providence Park. And on the right side, it says, quote, chronically inflamed fibromembranous tissue consistent with implant capsule. So this was indeed the capsule read by the pathologist that was removed. Chronically inflamed, so there's inflammation that was left behind. And then it says adjacent fibrocystic changes with intraductal papilloma. This is like a benign mass and this is what was noted. This was within the breast parenchyma. So quote, adjacent breast parenchyma with fibrocystic change and intraductal papilloma, negative for refractile material lymphoma or carcinoma. And then on the left side, it says mildly inflamed fibromembranous tissue consistent with implant capsule, surrounding fat necrosis, which is dead fat that was left behind, that are removed, along with, quote, surrounding fat necrosis and giant cell reaction, negative for refractile material carcinoma or lymphoma. And this is basically over here, the information that I gave to the doctor was rule out BIAL, CL, CD30 analysis. So this gives to rest that you did not have that lymphoma. Remember, you said the BIA, ALCL, which is the breast implant associated anaplastic large cell lymphoma. You also said the BIA SCC, which is the breast implant associated SCC, is squamous cell cancer. Now remember, this is very rare of rare of rare. Now, the problem here is this: many, if not many surgeons do not remove the capsule. Even when they do remove the capsule, they do not send it off to pathology. And even when they send to pathology, they do not do the CD30 stain. So this lymphoma is very much, relatively speaking, underreported. Now remember, this is very rare. It's like you getting struck by lightning twice. To date, only 1,233 cases have been reported in the world, so between all the different continents and all the patients. So this is very rare, but still it's directly associated with the implants. And so you can see that you have the peace of mind that this is not going to come back and haunt you. Indeed, there was a residual capsule left behind, and indeed that fat necrosis was also removed. And this is the residual capsules. Now, thank you very much for showing that. So this was indeed inflamed tissue fat necrosis on the left side, like I mentioned, and this chronically inflamed tissue was removed. That was unhealthy. It looked abnormal, palpated abnormal. 6 cents needed to be removed so that you would be free and minus these pathologic tissue, and you would have only good healthy tissue remaining behind. And this is where that capsule must be sincerely, definitively, comprehensively removed without any doubt, leaving behind only good tissue. This incorporates the fascia of the intercostal muscle, which is the fascia in between the two ribs, the periosteum, perichondrium, the fascia of the serratus anterior, and the fascia of the pectoralis minor, and inferiorly, the fascia of the pectoralis major. Now, I will tell you, if you look at almost all the surgeons, if not all, a majority of the surgeons in the United States, you will see the word breast implant unless spelled out, explant, removal of implants. You will see the word total capsulectomy lined up. And this is where, unfortunately, I find, and this is my humble opinion, remember, this is my technique. My technique is what? No need for that unnecessary lift, no need for the drains, no need to send the capsule off to pathology to make sure it's not this cancer or breast cancer, which is very rare, but it has to be checked. To send cultures for bacteria and fungus, to take pictures and videos, and to show to the patients what exactly I removed, what I saw when I got in. Number 6, twilight sedation. And number 7, every patient, no matter what, they get the same surgery regardless of age or health. If they have many comorbidities and they're sick for my surgery center, then they go to the hospital to get this done. So there is no compromise because of the patient's health. And this is the confidence. Your surgeon must be willingly, happily, very assertively, directly telling you that I'm going to take it out. He must be a staunch advocate and a very firm advocate. There is no second guessing your surgeon. You don't have to squeeze it out of your surgeon. You should be talking to your surgeon directly, not to the PA, the nurse practitioner, or the nurse, or the medical assistant, or the liaison, or the public face, or the front desk lady. You should be talking to the surgeon directly so that when you get your surgery done, you have that peace of mind that the entire capsule and the inflamed tissue was removed and that it was tested. Look, in your case, had I just removed the capsule and left that fat necrosis behind, you would still be hurting. Now, another thing I want to mention, if I may, When you came to me, you had what were findings of a fibroadenoma, which is the most common benign tumor of the female breast. And remember, they put a clip on it. And remember, as you came to me, I said, I'm not going to touch that. That's not my role. My role is to remove the residual capsules plus that inflamed tissue completely, sincerely off. Remember, that is a oncologic / breast center case. This is where that fibroadenoma mass is not going to disappear. If anything, it's going to get larger. And the standard of care, I myself as a surgeon will see, that mass needs to be have removed before when they first saw it, and not to keep watching it because it's only going to grow larger. And in very rare circumstances, that fibroadenoma can become fibroadenosarcoma, which is a major problem and bad cancer. So you want to get this, and there's a clip there, and any mass of the female or the male must be removed, because even men can get breast cancer. There is an OBGYN doc that I know in Texas who does breast exams for a living for the OBGYN patients that he sees, and lo and behold, he ended up getting breast cancer. And so any mass of the chest of the female or the male must be removed in any part of the body because it's not healthy. Now we have nodules benign here and there in your case, given the ovarian mass, but you have to get the ultrasound, especially given the strong family history that you have given your mom. And so the point here is that it must be removed. It must be removed definitively. And that was the whole intended discussion that you and I had on Friday. And it was only around Friday, 4 or 5 o'clock, that I just said, you know what could be a better patient than you coming on and discussing? Because if you ask me, and very bluntly, you're the worst case scenario, meaning you have already gone through an explant and now you have residual capsules. Here's an operative note that's telling you and I that there is no capsules to be removed. You're still young and you still have the many symptoms that are highlighting towards breast implant illness. And as I go in, I know from what I'm hearing, because what else could it be? Could it be any thyroid problem? Could it be an adrenal issue? Could it be bad diabetes, high blood? No, these are all what are the hallmark features of what are the residual capsules. Now, I just want to go ahead and correct. You're a surgeon, and with all due respect, I do not know who he or she is who said that breast implant illness does not exist. Now, remember, this is the mentor advertisement itself that Caitlin, my nurse, just got.
Yeah.
And I'm just going to read. This is the mentor advertisement. This is also on my Facebook page.
Right.
This is what they're saying. And remember, this is what is highlighted by the FDA. They're saying, quote, patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. This is, ladies and gentlemen, breast implant illness right here. So he's denying that it exists. They're telling you it exists. This is the mentor advertisement. This is their commercial. So it exists because you know what? It's right here. And then they're saying individual patient risk for developing these symptoms has not been well established. Period. Some patients report complete resolution of symptoms when the implants are removed without replacement. So this is significant. So it is real, and there is a solution and there is a cure for it. And remember, the take-home message is what? Remove the implant and the capsule and any inflamed tissue around, so that when the surgeon gets done with the surgery, the patient and the surgeon have that complete confidence that all that inflamed tissue was removed and that you have no bad tissue remaining behind, and that it was ultimately tested. I will tell you, I talk to a lot of plastic surgeons. I meet a lot of plastic surgeons. And I'll tell you, they ask me, how do you do it? I have had other very prominent, and with all due respect, plastic surgeons reach out to me. How do you do it without drains? How do you do it without that unnecessary lift? Had you had a lift cutting around the nipple areola and down, and that lollipop or that S or the comma incision, that would be a lot of cut around the nipple areola, breast tissue, and when you do your self-monthly breast exam, you're going to find nodules, scar tissue irregularities, And if you feel a mass that might eventually throw you into getting an unnecessary biopsy or a scare or an anxiety about a breast cancer, remember 1 out of 8 or 9 women will get breast cancer in the United States. And so this is where you have to be able to do a self-monthly breast exam with ease without feeling the scar tissue, without disrupting the nipple areola area. Some patients have reported they have pins and needles, they have hypertrophic scars, hypopigmented scars, keloid type of scars, white scars, and a sensation that's never been the same. Some young moms have reported that they have not been able to nurse their kids, the babies, simply because they were cut around the nipple areola. So the goal here is do no harm. And the goal here is to remove the entire capsule implant and faithfully, completely, sincerely. So there is no second guessing. This last week, I had a lady from Austria. She had residual capsules. 8 weeks ago, we heard about our German patient. Same problem in Europe, same problem in South America. And unfortunately, the vast majority of the world does not want to even hear the word breast implant unless, guess what? It's right here. And the other thing I want to highlight here is breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they're going to develop complications, some of which will require more surgery. So they're not lifetime devices. There are 2 patients I saw earlier. One of them, 66 years of age, had both of their implants ruptured. She had both of her implants ruptured from the year 2000, and we're going to post her video, and you will see it was dent and block all contained, such that she now has to not worry about not only the spilled silicone, but the entire capsule was removed. The second patient was a young 35-year-old lady with, to my surprise, these are 15-year-old silicone implants, and this lady had what are what is a ruptured implant on the right side. Her left one was intact, and I thought it was going to be vice versa. Remember, I cannot tell which implant is ruptured or not on my exam. This is what they call and talk about the silent rupture, meaning if you have 1,000 plastic surgeons examine a patient, they cannot tell with certainty if one side is ruptured or not. The closest one can get to is an MRI without contrast, and then even then that has been proven wrong. Now let me ask you this. Now another thing I want to mention here is, because I talk to a lot of plastic surgeons, with all due respect, a lot of my friends who they are not are plastic surgeons, majority of them, when they ask me, they say, well, let me see what I can do. Let me attempt to remove. And I'll tell you, this is has to come from within the heart, not because the patient asked and they said, let me see what I can do. When the going gets tough, and sometimes it's a thin capsule, the surgeon feels uncomfortable. Remember, this is a surgery where if you have 10 surgeons, 9 out of 10 would not even want to consider and hear the word breast implant, unless let alone doing the surgery where they're going to remove the capsule. This is a relatively involved surgery. It takes me 4 hours. I hear the vast majority of the plastic surgeons, not only in the US, in Canada, in Europe, they're doing what is an explant and a supposed lift in 3 hours. And I will tell you, it is virtually impossible. I want to see a video. I want to see the chest wall showing that entire way that implant capsule was removed in the manner that I remove, because that's the ultimate way without touching or disrupting the breast tissue. When I did your surgery, I removed that intraductal papilloma because it felt abnormal, right? I did not want to touch that fibroadenoma because it was much further up into the breast tissue that you have. And this is where you need to go to the breast center to complete and basically physically entirely remove that mass fibroadenoma and send it to pathology so that it's completely removed, and then you don't have to worry about any of these masses on your chest. So if you ask me, my most of my other plastic surgeons that I talk to, they don't, number one, want to hear the word breast implant unless these are patients who go to the plastic surgeons, and the plastic surgeons, you will see vast majority of them write down on their websites breast implant unless it exists. There's just to be politically correct and to get the next patient. Unfortunately, there is a plastic surgeon I talked to a month ago who has other plastic surgeons, and one he has only dedicated only for removal because he said I can market him better because He only explants, and that way he will be more sellable to the patients because that authenticates him as an explant surgeon. And under the same umbrella, he's capitalizing on augmentation with his three other plastic surgeons. And unfortunately, this is an organized way of reaching the many patients and capitalizing on the many patients who are not wanting to explant. And so I say to the patients, you want to be able to do your homework, talk to the surgeon. There is no other better group of patients to talk to than the surgeon's previous patients, and to get that reaffirmation, that confidence that your surgeon's going to remove the whole capsule, that number one, your surgeon is not putting in implants, because remember, it takes only 1 hour or so to put the implants in, and it takes 4 hours. Last week, both of these ladies who I operated on last Thursday, it was a 10-hour day between the two of them. And these are relatively very involved surgeries, and you never know what you're going to find till you actually go in. And the point here is your surgeon should not be augmenting. And remember, you still can bypass this rule because of what I said about the other surgeon. So your surgeon has to be willingly, happily, and very assertively talking about breast implant illness and not be putting in implants. And number two, you have to have the videos and the pictures and the reaffirmation by the many patients' relief of symptoms that authenticates and confirms that you're going to get the surgery that you signed up for. And let's say if your surgery was done today, you have that peace of mind and that confidence that your surgeon did not leave any of it behind and that all of it was tested.
Absolutely.
Yeah. Yeah. Now, please ask any questions you have of me for any of the listeners, or Jennifer, if anyone has any questions. So please ask. Caitlin, do you have any questions from the audience?
Yeah, so one of the patients, or a commenter on Instagram, said, Dr. Khan is not my doctor. I had a mastectomy due to breast cancer and received gel implants in 2012. I had them replaced in 2019 because they were so hard and painful. Does insurance cover explant?
So this is a very good question. Insurance will cover an explant, but the insurance will say who told you to remove the capsule, right? And there is a code for capsule removal, total capsulectomy. And this is where the surgeons feel the amount of reimbursement is essentially minimal to none. And anyone who processes insurance to do these cases, they will, believe it or not, file for Chapter 11 bankruptcy very fast, because the reimbursement is anywhere from $800, $1,200, $1,500. And the insurances, when they do reimburse the surgeon, they will not pay the surgeon enough to justify the 5-6 hours of surgery. Remember, the cancer patients are more involved. The right and left mastectomy paddles have to be removed. There's going to be a flat chest aesthetic closure. Usually that 2/3 of the patients, depending on the surgeon's technique, they have alloderm, which is cadaveric skin. And the implants are usually larger in the 600, 700, 800 range, because these patients do not have any breast tissue. And so the point here is the insurance is, if any surgeon who takes insurance is never, I use the word never, going to do the surgery. If I took insurance, I promise you by the end of this week, I would be shutting my practice down, because the reimbursement is minimal to none. Nowadays, the insurances don't pay anything for anything. Nowadays, the number one reason for bankruptcy in the United States is medical bills, and the insurances are very good and quick to pay what they bundle it, which means they remove the implant, the capsules. Who told you to remove the capsules? That was not part of the surgery itself, and they will have a hard time. They unfortunately don't pay the surgeons much. They don't pay the hospitals even much. And they ultimately are asking the patients to pay more and more. And because the deductibles are way through the roof now, what they were compared to, let's say, 10 years ago.
Okay, and then a viewer on TikTok had a question. She said, I had my implants in for 12 years. I had them removed 2 years ago and still have all the muscle aches. She's just wondering if it can take longer for certain symptoms to be rid after explant surgery.
So you have to make sure and ask, did your surgeon remove the entire capsule? Look, in your case, we had an operative note that says capsulectomy was done, right? In your case, your surgery was, if I'm not mistaken, asking you 2.5 hour long surgery, right? So this is reasonable length of, but I'll tell you, it's 4 hours. That's how long it takes because it is an involved process. I wish I could be done in 2.5 hours. No. So there are 5 criteria that I myself use in order for me. And these are what I asked you. Number one, what was your incision time and end time? Because if your surgery was done in 90 minutes, an hour and a half, or 1 hour or 2 hours, I will tell you that surgery was not a complete surgery, even though you had what are very average size 320 or so cc implants. Number two, the incision has to be big. I have a lady in California. Her surgeon went in through the nipple areola to do what is a total capsulectomy. Impossible. 0% chance that's going to happen. So the length of time has to be 4 hours plus minus. The incision has to be, the diameter of the implant has to dictate the length of the incision, and your surgeon's technique should not be through the nipple areola. It has to be in the crease. You do not want to dissect around the nipple areola. You do not want to be going up and down. Only a horizontal incision that's going to hide in the crease. Number three, the surgeon has to do pictures and videos of the chest wall showing complete removal of the capsule and complete removal of the uh, inflamed tissue around the capsule, and a video and chest high definition picture showing complete removal and the cutting open of the implanted capsule, which you did not get, if I'm not mistaken. Number four, the capsules have to go to pathology. You will see many of the one surgeon I talked to, I said, why did you not? And this is a mutual friend surgeon. I asked him, why did you not send the capsules off to pathology? I said, well, it was a small amount of capsule. Now it would show it's only 3.5 centimeters by 4. Normally, the capsule size is 12.5, 13.5, depending on the size of the implant. So that in itself is proof what was sent was not much, right? And number five, the reputation of the surgeon is key, which means that the surgeon, myself, the next surgeon, the surgeon down the street, we all have a reputation. And your surgeon, there has to be a Facebook. Remember, your surgeon, if he is an advocate, he should be actively talking about breast implant illness, not just have a web page and say, unfortunately, today, in today's world, I have had other Facebook group owners reach out to me and said, for an advertisement fee, we will promote you on our Facebook page. We will asterisk you. We will get you highlighted. We'll get you more recognized. And you will be on the top of our list if you donate some money in the and promoting breast implant illness awareness, which again, it's a Stark law violation. For someone to pay someone in order to get patient traffic, it is illegal. And so, unfortunately, there's a lot of this going around. I talked to a patient a couple days ago on the Saturday when I did one of my phone consults. She said, well, you were on this top 10 list of explant surgeons. I said, that is a bogus list because who is the person? Was that person the board of explant surgery? Was he a plastic surgeon? No, it was another up to no good business guy who basically said, I'm going to compile this top dog who has a lot of following on Facebook, this top dog, this dog, and put my name there. And now he squeezed in another plastic surgeon and said, well, guess what? He's part of the group now, which is, if you ask me, false advertising and wrong advertising and misleading potential patients. And I will tell you again, someone trying to capitalize on this world of explant surgery. This is where the surgeons have to have that integrity and that confidence. When you got your implants, your surgeon should have ethically discussed this whole list of problems, right? They're not lifetime devices. Very rarely they are associated with the lymphoma. The confusion and BI symptoms occur. Screenings looking for malposition, nipple skin necrosis, rupture, amongst many other problems. This needs to, if anything, I'm just highlighting the obvious. I use the word too honest, if that's such a term. No, I'm just saying it's not worth it. And that's the take home message that you're putting forth right now. You were harmed by these implants. The good news in you is you were harmed just for a few years, right? From 21 till end of 23, and less than 2 years, it was all said and done, and you were out. Patients, unfortunately, live with these for decades, right? And this is wrong for the system, for the medical community, the plastics community, to send the word out that these are safe devices. Look, we have surgeons saying that this is a myth. I have to say, this is not a myth what's written out here. These are the manufacturers themselves telling you that these are dangerous devices. Some surgeons have said these are the most studied implants and they've been safe. Guess what? They've been banned before. They are only replete with problems. And as you will see right here, breast implants are not considered lifetime devices. The longer people have them, the greater the chances are they will develop complications, some of which will require more surgery. So they're last 10 to 15 years. So if a young lady like yourself gets implants, you will see how many times you're going to need to replace them and then have to deal with the consequences of, in some select patients, the breast implant illness. And I just want to highlight in you that hair loss was a big thing. From my practice, anecdotally, 5-10% of the patients have reported hair loss issues, you know. And so some patients it will be the palpitations, some patients it will be the migraine, some patients the panic attacks, some patients a capsular contracture, such was your case. But eventually there will come a time where time will catch up with this rupture. Time will catch up with the autoimmune issues, right? Because they're not lifetime devices. Time will catch up with BILCL very rarely. Now, this is underreported, but it will eventually catch on. But eventually, it will catch on. Sometimes it may be death from a heart attack. It may not involve the patient's implant illness, but if the patients live long enough, they're not supposed to be lifelong devices. I have unfortunately heard from plastic surgeons who have told my patients, if you have a ruptured silicone implant, it's okay, don't worry about it. It's not doing anything. It's a silent rupture. You'll live happily ever after. Wrong information. They're telling you get an MRI at year 3 and year 2 every year onward because it's not healthy to have implants. Otherwise, why would they have you get this MRI, the manufacturers? Because it's not healthy to be living with ruptured implants. Malpositioning of the implants, rupture, the capsular contracture, again, no one walks into my clinic and says the implants are making them healthier or they're making them better or think sharper or better. Any other questions, please?
Yeah, so an Instagram follower said, when you talk about removing inflamed tissue, have you ever removed lymph nodes as well?
So this is a good question. Whenever I'm doing an explant, do I remove lymph nodes? So if I see a lymph node in the path of that capsule, I will remove it. Now, if you go in and Google lymph nodes to the arm, to the breast tissue, you will see primarily most of them are in the axillary area. Some grade 1, like level 1, level 2, level 3, and along the side. But I am not going to dissect in the armpit and the axillary area because that's going to only lead to lymphedema. So if a lymph node is only in the path of that capsule, I will only then remove it. I'm not going to go out of my way in removing lymph nodes from the armpit because that is dangerous and wrong. And for the same reason, some patients ask me, could I get my lymphatic massage? No, it's only meant for those patients where they have breast cancer and now the mastectomy surgeon has removed all of those lymph nodes and now the arm is swollen. Then those patients need lymph therapy, lymphedema, clinic garment, compression garment, lymphatic massage. My patients need the gentle massage of the chest, breast area so that dermal lymphatics are essentially toned up. And when you massage, you calm those nerves down, which were cut. You cause nerves to come in an orderly fashion towards the skin so that patients have good nerve sensation in and around the nipple areola. And number 3, as the dissolvable sutures are placed to basically you will see that over the next year or so that the scar tissue settles and the patients are now able to have a very good aesthetically appearing scar that's going to only hide in the crease.
And then another Instagram follower asked, I'm assuming post-operatively, what weights can I use once you tell me I'm healed enough to use them? Is it like 1 to 3 pounds maximum? Does it progress over time?
So the question is post-operatively, what weights can I use? So normally, majority of the implants are below the muscle. So the pec major muscle needs to settle back under the chest. So the first 6 weeks, the lesions are going to be in the T-Rex arms, which means the elbows are going to be glued towards the chest, and they're going to be able to just move their wrist and hands. So for example, if the surgery was done today, the patient could very well the next day type text, use the keyboard, make self sandwich, make coffee, no problems. But you cannot lift a gallon of milk. You cannot drive. Now, day 6, day 7, when you're off the pain meds, your reaction time is good and you're confident and you feel comfortable and your reaction time is good, then you can drive. For 6 weeks, you're in this position, you're letting that muscle settle. Just like in the 6 weeks after a tummy tuck, you're not going to move around, you're right, you're not going to go sit-ups or go up and down stairs excessively. The only activity you're essentially allowed is just gentle walking on a level surface, no Peloton, no biking or anything like that. Now, at week 6 mark, I then have my patients gently start doing the bicep curls with the 2-pound weights. 1 minute in the morning, 1 minute in the evening. The following week, 2 minutes, 2 times per day. Third week, 3 minutes, 3 times per day. And then they will basically start building not only the pec major, but the pec minor, the latissimus, the deltoid, the suprainfraspinatus in the back, the trapezium, such that their neck, back, shoulder is only going to be improved. And I want the patients to guide themselves using their inner sixth sense and not to go to a therapist. Because when you go to the therapist, they follow a protocol and they say, oh, I feel the burn. And then they say, no, ignore that and keep going. No, I want the patients to stop. And then not in 1 month, 2 months, but over the next 4, 5, 6 months, using the same 3 to 5 pound weights, you could build yourself a whole lot of muscle mass that will only add to your posture, that will add to your upper extremity dexterity and function and sports, the ability to play golf, tennis, things like that.
Okay. Another question says, under what circumstances have you had to do surgery under general anesthesia rather than the usual twilight anesthesia?
So I use what is twilight anesthesia, which is propofol, fentanyl, Versed. This is deep sedation. To date, not a single patient has woken up, recollected what happened. That's more for like the movies. And this is where the patient's not paralyzed and they do overall very well. And it's very effective, remember, outpatient surgery. Now, in some select patients, I have done general anesthesia where there is patients paralyzed, now cannot breathe. You have to have a breathing tube down and the ventilator is breathing for the patient. I was operating at the hospital. As soon as I made cut, there was an abscess infection of the right chest and a ruptured implant on a 68-year-old lady. For her comfort, so that she's not in any uh, distress, and for me to be able to dissect completely definitively, I asked anesthesia to go ahead and paralyze, and then I was able to operate on her comfortably. Now remember, every day, millions of every day patients undergo general anesthesia, from kids to I when I was doing pediatric plastic surgery, there was a 1 day old baby. We had to do general anesthesia and the baby did fine, right? So general anesthesia is very safe. It's done every single day. But in the explant world, twilight sedation is very safe, very effective, gets the job done. Patients recover well, less chances of problems, no ventilator associated problems, no barotrauma, no paralysis. When you paralyze someone, you basically cause the muscles to relax and now blood can pull in the legs. So less chance for those problems. In the twilight, I always give my patients heparin sub-Q 5,000 units to help with DVT prophylaxis. Everyone gets the squeezy SCD boots, which is the sequential compression devices. Everyone out of bed to cheer on the day of the surgery. The following day, I require my patients to gently walk with assistance while precautions. And this is, again, with the twilight and all these precautionary measures, we stay away from potential any disruption or any DVT issues.
Okay.
If I can just jump in really quick, I'll say I've had both surgeries, both types, one with the drain and one without, and I will say I prefer the one without.
Yeah. So, and can I ask you, Jennifer, how was your anesthesia experience?
It was great. I mean, I didn't remember anything. I just, went to sleep and woke up and it was all done.
Yeah, if you listen to many of my patients, literally, I would say they're actually literally snore through their surgery. You know, they're like in mild, gentle snore phase, if you will, the deep sedation. They have no recollection. Now, if I may mention, I give a local nerve block, which is lidocaine, epinephrine, and marcaine, a total of 40 cc's, depending on the age and comorbidities of the patient, the age as well. For some select patients who have taken Norco for endometriosis or Percocet for chronic neck and back pain, for an added minimal cost, I can give also Exparel. We can give Exparel that lasts 24 to 72 hours. That really helps with the pain as well and minimizes narcotic use around the time of the surgery. And this is unfortunately cost prohibitive. You would think all the kids that get surgeries would be getting this. No, it is unfortunately because of the cost. Only select patients who pay for it will be unfortunately be able to give it. I wish they could make it cheaper so that they would do it routinely. Even dentists would do it because that way, why live with pain when that way you avoid the Norcos, you would avoid the Percocets. And I'll tell you, if I was with the FDA, I would ban implants yesterday. And number two, I would make Exparel available to all health providers so no one has to even look at Norco or Percocet at least for the first 3 days.
That leads really nicely into our next question. A Instagram follower said, if I tolerate pain well, do I need Exparel? Is there a way, once you see what's going on inside with my implants, for you to make the decision to use Exparel if you believe there was more inflammation?
So this is a very good question. So 2/3 of my patients, if you follow my private breast implant illness support group page on Facebook, you will see 2/3 of my patients with confidence, if not more, do not require much of pain meds, even though you see that vast area of surgery. And this is where the care of the dissection, complete removal of inflamed tissue, and in a very nice, sophisticated, gentle way, where 99.5% of the time the blood loss is less than 5 cc's, the need for the pain medication is not there. So if you ask majority of my patients, a good number of them have taken 1 or 2 Norcos, if at all. They have not required much of tramadol, and they overall do well, even with this basic quote nerve block with the lidocaine, epinephrine, marcaine. And so I tell my patients, only time will tell. I always err on side of giving it to the patients because I don't want the patient to be without it post-operatively. And one can err on side of caution. You can get the Exparel, so at least you have the peace of mind you did it, because Murphy's law is, if you know, again, you did not, then you'll probably end up needing it. But most of the patients do not. So let's say, for example, knowing what I know and given my patients, if my loved one was to get surgery, I would say don't even do the Exparel unless you know you're going to have pain issues. So one patient I took care of last week, she's taken Norcos for endometriosis and Percocet and OxyContin. I know, and she knows better than I, she's going to have pain issues. So she would be a very prime candidate for getting Exparel. Now, if someone says, well, if I get the Exparel, there's no hurt in getting it. So now I don't want to use the word waste. You wasted the $400 into getting something you did not need, but at least you have that sense of security and confidence and that wisdom that you were not in the hurt, if you will. So now let me ask you a question. As you came to me, now this is a very, I use the word going back, and this is your gut. You know, it takes a lot for someone from Arizona to have read into and seen and heard. Remember, if I were you, I can only imagine. I know it's not going to work for me because I'm not that lady, right? Did that go through your mind?
Um, I mean, I certainly had the question of, and the prayers. I really hope it works. You never have that. I mean, I'm walking in 100% new territory throughout all of this, and I'm learning so much. And unfortunately, I've learned it maybe a little bit 2 steps behind or too late. But I guess that's the point, because a lot of us can't go into this situation perfectly as we would like. We find ourselves maybe in many different parts of this path, but the main point is that there's help. There are options. There is the correct way to do it. There are experts that know how to do it and are willing to do it. So all it takes is a little bit of determination and willingness on our own part to figure out and find that what's best for us and do that
Mhm.
and do what it.
No, I hear you. That's very well said. Now, next question for you. If someone else is listening, right, and they say this is all in your head, you're meant to get better, you know, and this is all a placebo effect, what would you say to that?
Well, I would ask them to clarify what's all in my
Like
head.
meaning the improvement, the hair,
Yeah,
the migraines, the anxiety, the panic, and all these symptoms that you mentioned earlier, that this was just a phase in your life, you were under the stresses, or what you're seeing right now is like, you
I've been
know.
in many situations like child labor. I've never lost all my hair. I've never grown 3 masses in a year. I've never had, I've had migraines before. I've had panic attacks before, but not like it was when I had breast implants. So I knew what I was like before and what I was like right after. And it was easy for me to see. It was clear for me to see because I had made no other large changes in my life other than the breast implants. And now I know for certain because once they were removed, the symptoms went away. And so, for example, I had normal high blood pressure my whole life. The 1 year I had implants, my blood pressure went high. As soon as I explanted, my blood pressure went back to normal. So now my blood pressure is normal. And that's just one thing. Also, my hair is growing back. So it was falling out. And it didn't matter what I did, how many 8+ dermatology appointments, all the different things to try, all the different medicines, all the different products out there, and nothing was working. It was still falling out. And it wasn't until I actually took the breast plants out that it stopped falling out. And then once I explanted everything, it actually started growing back. So all the holes are filled in and my hair is coming back, which is huge for me. That is a joy in my life that was lost. So for that, it's worth it, but also for how I feel. I can breathe easier. I can see better. I can feel, I feel my body coming back, and there's no words to describe what that feels like. And I will say, I will go back to saying, I know we talked about the cancers and the concerns that that put on women, and I know that some of that might be underreported, and but it doesn't mean that any of those people are less important.
Right. No, I get your point. Yeah.
Are going to find that they might have cancer. Isn't it important to know ahead of time, to have that extra time, to take the steps necessary to help yourself? If I hadn't have done this and it had come back that mass was cancerous and I had never done any other surgery other than the first explant, I would still have the capsules in me. I would still have the infected tissue. I would have nothing sent to pathology. I would not know whether or not I was cancer free or not because the CD30 very specific test would not have been done. And I would probably still be sick, but I wasn't going to take that risk. Whether I did not want to suffer one more day.
Yeah, no,
No.
I hear you. Now, I myself, as a board certified plastic surgeon, having been and seeing implants since 1998, I will say this as someone with no bias and an objective mind. Your story is exactly verbatim, like all the tens of thousands and hundreds of thousands of ladies, the same problem in 92, and all the other ladies, the Danica, basically, the same, the race car driver, Patrick, on all the other ladies who are explanting. And, shame on those doctors, plastic surgeons, anyone in the medical community or non-medical community who question the authenticity of your words and your improvement. You could be wrong, but not the 10,000, 15,000, 100,000 other ladies who have explanted in the 90s and who have nothing to gain. Look, you're a lady with intellect, wisdom, you're a business owner, you have 3 kids, you have a whole life ahead of you. And look at the hurt. And this is the whole take-home message from this person wellness, page. Do no harm, hurt no one. This is not worth it. Eventually, everyone will succumb to this one way or another. small, small, small. No one's going to say, okay, I'm going to live with an implant happily ever after, which unfortunately, many of the plastic surgeons are saying that implants are the safest devices on earth. They have been the most studied. If anything, just the opposite. They will eventually end up hurting, some sooner, some later, and they are not lifetime devices. And this is the awareness that you have raised today. And I'm glad that you were able to come on. Literally, this was the last second. As of this morning, no one from my office knew that you were coming on, and I appreciate you sharing your journey. Now, please, I'll let you close. We're thankful to our listeners from Instagram, TikTok. Remember, we're doing it in a very professional, nice, sophisticated way. Yes, I am relatively assertive, but I have not said anything today that is exaggerated. This is all echoed in these uh, uh, warnings, if you will. And let me just say one thing and I'll let you finish. If I am a young lady, 21 years of age, or that lady with breast cancer, 65 years of age, and if I read this, that they're not lifetime devices, they have a very small association with the BILCL, that they can cause confusion, autoimmune issues, brain fog, rheumatological joint problems, that malposition, rupture, they're associated with capsular contracture, a bacterial biofilm, acute chronic pain, fat necrosis, not able to do a self-monthly breast exam, and malpositioning, asymmetry, amongst the many others. I would run as fast as I could because this is not safe. And that's my take-home message. Do no harm. And those ladies who are considering, go get the implants, but please know what you're signing up for. And those ladies who are hurting, just like you very well said 5 minutes ago, there is a relief and there is an answer out there.
And I would like to leave with just this message, that everyone matters, and that no matter where you are in this story, there's hope. And I wrote out my story in poem format. I told you earlier. I'll post that at a later date, but I'd like to just read you the last 4 lines of.
No, please, absolutely.
The voice of one doesn't matter. The story of a woman, just gossip or chatter. The right to be heard, helped, and informed. Too many gaslit, misled, silenced, and scorned. The tears that I cry are for you and I, the ones that can't speak now, but tried. The ones sitting in confusion and breast pain that cry. The ones now sitting in silence that hide. And I just want you to know you're not alone. There are options, there's hope. And there is a knowledge of information out there and experts that are willing to help. And I would just encourage you to find them and find your path, whatever it may be, and never give up on yourself.
That was very, very nice. You have a talent, and I wish you kept going. No, we would love to hear from you. No, that was very nice. That was very strong what you read. It was very creative. I'm extremely impressed. No, great job. No, thanks for sharing your journey. God bless you. You have a wonderful heart, wonderful soul, and I am delighted, and it was a privilege to having taken care of you with my team. I want to mention we have from my nursing staff, Caitlin, to our front desk, i.e. Marlena and Sally. We work tirelessly from my staff, my CRNAs, my first assist surgical tech, and we are honored to have taken care of you and helping change how medicine is practiced in the long run, so that we ultimately help everyone and do no harm. And that's the goal.
Absolutely.
Thank you. Thank you very much.